as parents, you're nervous. It's your child. That's your life there. Early on, thought so-called normal baby, and up to like 4 years old, some stuff started happening.
One of the problems in child neurology is that a lot of people don't understand neurology. A lot of people are afraid of neurology. And in that sense, a lot of times we get patients late. People think are just, oh, they're just funny baby movements.
She complained about her stomach or a little dizzy, and then from that point forward, until we actually got her diagnosed, we realized that she had epilepsy or seizure disorder.
When I was little, they found out that I had like epilepsy, and I'd have like seizures like more than once a day, so it was really tough. I'd have like these feelings almost, like I can sense it coming, like my eyes would start to like almost get cross-eyed in a sense.
People are scared when people have a seizure. They don't know what to do, and there's a lot of bad misinformation out there.
I didn't really understand or know what was happening when I'd have it because I was kind of just like blank out.
Obviously, everyone's telling you that it's something she's going to have to live with her whole life. She went through anywhere between 7 or 8 different type of medications, combination of medications, and nothing seemed to work. Eventually, we were having a conversation with the doctor, and she said that maybe UCLA would be your best choice, but it's going to be extremely difficult to get in there because everybody in the world wants to go there. Did a PET scan, a CAT scan, and an active MRI, and they fused them all together, finding out that the reason why she's having all these seizures was a tumor. It's difficult when Doc came out and was smiling, and at that point we knew, wow, this is going to be great.
Although like it was kind of like a painful experience, like literally a day after I came home from the hospital, I didn't have a seizure, even one.
It was a miracle. Truly, you always hear miracles and stuff, but this was a miracle. Not only to be able to get there and pinpoint exactly what it was causing, our daughter not to have so-called normal life, be able to do the things she loved to do, from soccer to softball to even in school. Everything was difficult for her.
So because of Dr. Lerner, I feel like I have more like motivation in a sense to like strive to like push myself to the limits that I didn't think at once I could have, like let alone like I'm graduating from high school. Most people didn't even think that could happen. So like I'm forever thankful for like the technology and the abilities that the UCLA had.
Definitely still a lot more to do. A patient like Ashley, who went from having frequent seizures to being completely cured of her seizures, now graduating high school, getting ready to go to college. That's amazing. Each year I think we're getting closer to that goal of either curing epilepsy or treating it to the point where these patients have their lives back.